Victoria, and today we're going to be discussing dehydration. So dehydration occurs when we have water, either fluid shift or fluid loss in our bodies. Our bodies are consisted of 60% water on a regular basis. So the two different forms of dehydration, we have relative dehydration, which occurs when fluid shifts out of the blood plasma into the interstitial fluid. And then we have isotonic, which is the more common form of dehydration, which occurs with vomiting, diarrhea, sweating, when you have fevers, situations like that occur fluid loss as opposed to shifts. Your increase at risk for dehydration when you ingest large amounts of caffeine, alcohol, when you have vomiting, diarrhea, when you increase activity levels without increasing your fluid intakes, people who have impaired mobility, so they're not able to get up and have access to fluids as well. People who take diuretics also tend to be more at risk for dehydration, simply because that's what that drug does, is it causes fluid loss. Signs of dehydration are increased heart rate or tachycardia, decreases in weight greater than 2.5 pounds in a very short period of time, decreased distal pulses, so peripheral pulses, so like your pulse in your wrist, if that feels very weak, that can be a sign of dehydration. What we call orthostatic hypotension. So when you change positions, your blood pressure will lower, causing you to feel lightheaded, dizzy. You can pass out and fall. That's a dehydration sign. The elasticity in your skin goes down, which is called turgor. So when you pinch on your skin, it does not immediately retract. It stays tinted. Dry mucous membranes, so your mouth feels really dry and cottony. Like the membranes in your nose can get dry and crack. So all of that is dehydration. Confusion also, especially in elderly patients. They get very confused when they're dehydrated. Another indicator is your urine. Dark urines are very conclusive for dehydration because it's very concentrated, and it will also have a very strong odor to it, again, due to the concentration. So when we do lab work to check for dehydration, we are going to take into account weight loss. So typically patients that are admitted at risk for dehydration get weighed every morning just to monitor and make sure they're not losing excessive amounts of fluid. We're also going to monitor eyes and nose, which is intake and output. We want to make sure that for dehydrated patients, we want a greater intake than output to help balance. But we also want to watch, make sure we don't put them in fluid overload while we do that. But you're also going to look at the urine's specific gravity, because a high specific gravity means that the urine is too concentrated, which is a dehydration symptom. So we want to make sure the urine gravity is around 1.1 or 1.03, sorry. You'll also see decreased urine output with patients with dehydration because it inhibits the antidiuretic hormone, which will cause your body to save all the fluid that it can, which is why that urine is so concentrated. So to treat, we're going to, of course, do IV and fluids by mouth, or PO fluids, because we want to just increase the intake. We can also use antiemetics, which help stop vomiting, antidiarrheals, which stop diarrhea, and antipyretics to help with fever, so like Tylenol, ibuprofen, to help reduce fevers, to help them stop sweating. From a nursing aspect, for nurse safety, we're going to put our patient in falls risks because of that orthostatic hypertension. When they move positions quickly, they get dizzy, so we want to make sure we have somebody with them when they move around, just to make sure they don't get dizzy and fall. Again, monitor the eyes and nose. We're going to watch for confusion and muscle weakness as well, because with dehydration you often get electrolyte imbalances, so we want to make sure that we don't have any of that occurring. So we want to make sure we watch their neuro levels and their muscle levels as well, make sure they don't have any weakness. When teaching our patient, if we're going to discharge them home, we want to make sure that we educate them that they would take about 2 liters of fluids a day. And we mean, when we say fluids, we mean like waters, electrolyte drinks like sports drinks, not alcohol, not caffeine. Just because you're drinking does not mean it's hydrating. So again, avoid caffeine, avoid alcohol, encourage water and sports drinks. If they're going to be out in the heat, either exercising or if they work outside, they need to intake more than that 2 liters to combat for the sweat that they're going to lose as well. So, and then if they have infections or if they're nauseous, they also want to increase their intake. But if they're nauseous, they want to take like small sips of water at a time so they don't force themselves into a vomiting episode. So small batches of fluid if they are nauseous. So when teaching your patient, you want to make sure that they're able to understand what you have told them. So, and you can just do that by having them like explain back to you what you explained to them. And if they explain back correctly, then they probably do understand. Or you can give them situations. Like, in this situation, how would you do? Just to make sure that they understand fully what you have told them and give them their best chance of getting better. So that is what we would do for dehydration.